and welcome to another session in the Formfast Educational Webinar Series. I'm Aaron Vaught, Marketing Manager at Formfast. I'd like to thank you for joining us. Today's event is entitled On the Path to Automation, Reaching for Stage 7 of the EMR Adoption Model. We're featuring Broadlawns Medical Center, and we're looking forward to their journey up to Stage 6, the steps they're taking to achieve Stage 7, and some of the plans for other health IT technologies in the future. But before we get into presentations, I'd like to go over a few housekeeping items. You'll hear the audio for the session through your computer speakers. If you have problems hearing the sound, send a message directed to the host so I can approve you to join the teleconference. Once approved, make sure that computer speakers are muted, as you might hear an echo. Questions if you have at any time during the presentation in either the chat window or the Q&A section of the screen. So, if you join us for the first time, I'd like to take a brief moment to introduce you to Formfast and provide some context for today's presentation. Formfast is a provider of automation solutions for healthcare, including electronic forms management, or eForms, workflow automation, business intelligence and process improvement solutions, electronic document storage, and output management. We're proud to have 100 hospital clients internationally. We're a preferred or formal partner with industry leaders such as Meditech or McKesson, and we're #1 in eForms management in healthcare. We have over 20 years of industry expertise in healthcare. Part of what we do is prepare hospital forms for archival in the electronic medical record. Part of what we do is prepare hospital forms for archival in the electronic medical record by dynamically imprinting both patient demographics and barcodes onto our eForms, organizing and outputting packets of documents, which times the indexing within the EMR. And we're having some issues with the audio. Okay, please send a chat if you're having issues with the audio, and we'll connect you to the teleconference. While you may be aware of the significance of the electronic medical record, it'd be useful to review why healthcare is focused on the EMR for the sake of today's conversation. In 2009, the government, as part of the American Recovery and Reinvestment Act, issued the Information Technology for Economic and Clinical Health Act, also known as HITECH. It aligns criteria for rewarding incentive payments to hospitals and other healthcare providers that demonstrate meaningful use of applied EMR technologies. The incentive payments began in 2011 and will continue on a phased rollout until 2016. However, for providers that fail to adhere to the criteria in HITECH, penalties will be delivered beginning in 2015. The EMR adoption model was started by Analytics in 2005 as collected data on EMR technology adoption trends, created to track the progress of the implementation of these technologies across hospitals and IDNs. The model is divided into 8 categories, 0 through 7, and an organization must complete all aspects of one stage before getting credit for the next stage in the model. As we can see in this chart, which you can also find on the HIMSS Analytics website, the majority of U.S. hospitals are currently at Stage 3, with 43% indicated at the first quarter of 2012. That's why we're pleased to be showcasing Broadlawns Medical Center, as they have reached Stage 6 of the EMR adoption model. The elite percentage of hospitals to be certified at this Stage 6 and are actively pursuing Stage 7 certification. Not only would that put them in the 1% of hospitals to achieve this prestigious status, but it will also make them the only second Meditech hospital to do so. Story, followed by Sean Curtis, Formfast Director of Product Management, to discuss how Formfast solutions play a critical role in helping the hospital reach its paperless goals. But joined today to share their journey to achieving the highest levels of the EMR adoption model, we have Kyle Hansen, IT Director at Broadlines Medical Center. Kyle was instrumental in directing Broadlines through the challenges in implementing these technologies and will be sharing some of the lessons he and his team learned through the process. Kyle, thanks for being here. At this time, I'd like to turn the presentation over to you.
All right, thank you, and I appreciate the opportunity to speak today. I have a few joining us. I have everyone listed here on our slide, but we have Gino, who's a operations analyst in the IT department, Matt, Amanda, Jeannie, and Beth Compton, and myself, Kyle Hansen. Just a snapshot of who Broadlines is. We're located in Des Moines, Iowa. Name kind of odd name. We always have people, what was it? Name related because we used to have lawns out front. We called broad lots now just because all the parking lots, but we have a decent amount of green space out there. Recent projects that we've had here from a facility standpoint, we had a $35 million site and facilities expansion, the new emergency room department, same with the operating room, a new care building, and then remodeled several of our clinics. Currently involved in 3 medical home programs, and we have over 1,000 enrolled members in those programs. Next slide, we're looking at kind of the makeup of our IT department. We have currently have 12 full-time employees. Added additional clinics in the past year, and as we mentioned, there are operating in what we usually put forward to capital expenses. Here are the accomplishments we're proud of that we've achieved over the past few years using different IT solutions. As you'll note, throughout the slides, I'll put a little asterisk in certain stages of what some of these things apply to for the HIMSS level application. Of every one of these mentioned here on the slide, one we're proud of just due to our medical home involvement is our recent QA PCMH certification that we achieved this year. The process for us, it was probably the reporting that we've had to do for certification. There's a section that's specifically for meaningful use, but different kinds of reporting we had to do based on workflows that we have for refinement, disease management, and other items like that. So we've learned things that have helped us, some challenges we faced. Our number one there is our C-level support has been phenomenal during the implementations. In touch with the technology and the different solutions. They don't challenge things we present, but usually very good discussions when we're presenting, next steps, things we want to do, and it just that carries the rest of the organization, makes it a lot easier rolling out these changes. Now, communication with all staff members. We've encountered this during some of your implementations. People are fearing that maybe job position is going to be eliminated, or that they're going to be transitioned to a different area. There's more coming up that we all have to adhere to, and some of those past job characteristics are now characteristics. So that steps is just calm people's fears, just tell them, why we're doing this, implementing certain changes. It worked out very well for us. We have several, we have steering committees, some finance for IT, and then a few different clinical steering committees. Also, champions in different areas, whether it's a support staff or the overall director. Just change makes it that much easier to buy-in, and that's something you'll see everywhere. I think any presentation they'll talk about some champions in some of their different areas. The change, there's going to be things that people like, hey, why are we doing this? You just promote, the positive aspects of it, negative ones, and just explain why you are doing certain things. And when you approach it like that, it's just a much smoother transition. At first, we were having some challenges actually getting of the electronic applications in the clinical areas. And as our approach is, we worked with a couple areas where some of the providers worked in different areas of the hospital. They were on some of our leadership committees. So working with areas, and it spread from there. Our CMO is actually a practicing physician as well, and that is definitely one of the first areas that we brought. It was not the first, it was one of the first, and things really progressed well after that. Your vendors actively involved. Most of us here on the call work with MedTech, work with Formfast, and other similar vendors, and it's really key. You have to keep up to date on some of the things they have coming out. Implementation time frames fill up quickly, so you have to be looking ahead, and you have to keep your organization educated on some of those upcoming events. Now from other sites, we're doing that too. We do that with other people. We'll reach out. We have conference calls. It's just, we're on the same boat with the same person. So you work at one place, we'll typically work at others. So we'll be reaching out and finding similar sites to work with. We encountered during our implementation is disparate systems can create barriers. They work very successfully in some cases, did not the most efficiently here. There were workarounds we had to do with certain clinical records not integrating with the rest of our applications, and luckily we decided to implement a solution for things, and we got everyone on the same platform. We're definitely seeing some of the benefits of that. And Meditech timelines, we contacted with Meditech and LS back in, I think it was 2005, for implementation in first quarter 6. I'm sorry, it was second quarter 2006. We recently rated the client server 5.65. I'm not going to discrete application we brought up and when, because that could really turn into probably an entirely different presentation. But there's kind of the key rollout. With Formfast, we also implemented their output management solutions. At the same time we were rolling out Meditech, we used the solutions for table checks, payroll checks, all of our patient forms, wristbands. This year we implemented the e-signature solution, and we do not know why we held off on that. We wish we would have done this back in 2006 as well. It has worked very well for us. To cover different alerts that we've built in Meditech, and we have one example of the parameters and different dictionary changes we did to implement one as an example. But some alerts we'll be showing you on some of the next few slides. If it's missing, you get alerted and can proceed in CPOE as well as nursing administration values. Values presented to providers when they're ordering certain medications. Another alert for when it's very similar to height weight if allergies are not documented for CPOE, as well in one of the nursing assessments, how urinary catheter provider document for adequate core measure documentation. Examples you see on the next screens, none of these are real patients. They're either an IT list or just a name we used. The missing height alert, you notice up here in the patient header, there's no height listed. We can see the kilograms. Go to the next screen, and the RN attempts to administer that drug. They get this error and they cannot proceed. So they have the appropriate information, make sure we are administering appropriate medication levels. This is anticoagulant alert. When this example, Coumadin 5 milligrams being ordered, the provider will be presented with the lab value for the INR in this case. They are then required to implement a clinical indication that we defined here at our facility. Allergies missing. Thing they can see medication, but they must enter a known allergy, unobtainable, or actually enter the actual allergies to proceed. Catheter documentation. This is the nursing assessment section. The nurse will, put the date and time, whether the care is still in place, and whether the physician has been minded to document the need to continue the catheter. Next is what the provider. This is actual provider note, and as you'll notice, if it's hard to see, I believe this presentation is available to download. But the date, it carries forward as well as the other information the nurse has filled out. Let's look at Formfast solutions we've implemented, and all these solutions we're showing pertain in some form to the primarily stage 6 and 7, but we'll see some other items in here as well. Our management, web imprint, and e-signature is what we're using. We're currently using this in the point contact areas for e-signature. The consent process used to take, on an efficient time, just over 60 seconds for that form to generate from Meditech, to print management, to actually print out on the physical printer, for the go get the printer, get the patient's signature, and then scan it into the system. Some examples of how this workflow works, but on average, in the first few weeks of implementation even, it was an average of 14 seconds, that process. That's a significant time savings for us. Paper savings, we offer the patient a signed copy. Hardly any ever take it, but we have that documented if they've been offered the signed copy. And so we're using the paper savings. Great benefits, as well as less money we pay out for operating expenses. We start to utilize e-signature. in the ER, OR, in the inpatient areas for consent. And one requirements for stage 7 for like consents. It's not that you have to be totally paperless for stage 7. For things that are not really clinically relevant with clinical documentation other than just the patient is signed off, have to be in the record within 3 days of post-discharge. Items like any orders you may have, those are required to be in the record within 24 hours. So we'll go over examples. You've probably seen the this is the Meditech registration screen. We're using Snoop Dogg here. It's actually not the real guy. This is a fictitious name. And here's the screen you're presented with for the forms. I did it to the Formfast printer, which then is picked up by Form Output Management. And web form and print. This is the electronic signature routine. This list is actually populated. We developed a SQL query that based on location, the machine that the registration staff is at will only see that location. We define that. And once it's signed, there's a status of signed. So I can allow items to go up here in the patient list that have not been signed. So we find Snoop Dogg in the previous screen. He's come across here. You select it. You click. I don't know if you can see my mouse, but you click the little sign button that's highlighted just up on one of the toolbars. And registration staff would see on their first monitor. We'll show a picture here in a few slides of what our actual physical setup looks like, but this is the screen they're presented with. Activate the signature pad. Again, if you cannot see my mouse, I apologize, but the blue highlighted boxes in the middle of the screen, there's a little sig pad off to the right. You click that to enable the field. It sees this on the second monitor facing them with the sig pad in front of them. They actually sign that same box that we activated. Done. The registration staff then clicks the done button at the top of the screen. Presented with this archive all. It says, "Be sure you want to archive all forms." They click yes. At this point, they're done, and if they're done speaking with the patient can go sit down, proceed back to the area. Registration staff can then work with the next patient. In the background, what it does is it creates a form out in a directory that Meditech cold feed looks at just a normal background job, looks at like every 30 seconds, picks that form, it's then imported into Meditech and available for staff to see. The process completes. The original list is this Snoop Dogg is dropped off because that query where we had him marked is the form needs to be assigned. Now clear, the next person registered to that area would show up. This is in application. The staff picked it up quickly. One person does not like using it. Our only knock on the process is back on this form. You have at the top to actually click done. In addition to the Formfast developers, workflow, us really working at it. You scroll down, it'd be nice to have that done button down next past delete, but that's our only knock. Hey, we'll live with that. Back to the scene. Here's that whole of the area of the patient view. As you monitor on the right, patient viewing monitor, that's where they will see their consent. Just after that is the SIG light pad. They actually sign just like any point of any retailer you go to. To left, it's a palm vein scanner that we actually use for our check-in process, where the patient places on that. After they're enrolled, it recognizes their vein pattern and pulls up the patient information in Meditech. So, correct match. The registration monitor just behind that, and then the printer, because that thing does not work anymore. It just sits there. This process is great. The staff doesn't have to leave their desk. We're not currently printing any forms in most of the areas. This big light pad that was on the countertop where they sign, that ugly looking scribble there is my signature. I have some of the worst handwriting you'll ever see, and something working in healthcare. Slide is registration staff view. This is the point of view, and that's the e-signature process that we're using in point of contact. Another solution that we implemented, we really rolled out B in the nurses. We have a rate of the nurse being able to scan the patient's wristband. We used 3 of 9 barcoding, multiple scanners. It was not the scanner; it was just the label, the curve, and the label, and the patient's wrist. So we worked on developing the 2D barcoding. As you can see at the top of that wristband example there, there's 7 2Ds across there. What's it look like? 15, 20. Actually hit any of those and scan the barcode. And the percentages spiked dramatically. We now have well over 90%. Requirement for stage 7 is 95. We're definitely hitting that. We had small work groups that we've implemented, and those percentages just keep going up and up. So we feel we can achieve that quite easily now. But the 2D definitely played a role in that. And that's, again, utilizing Meditech's generating that information out of the system into output management, and then there's certain programming that has to be done on a Zebra printer. And we actually, at the end, have an example how that was set up there. The solution is updated allergy bands. We were into, to grab the registration and print the appropriate allergy band, just because at that point the nurse hasn't even seen them to update the information. So what we've done to kind of skirt that, especially in the ED where we generate on registration, now it's generated after the patient's triaged and they're updated utilizing data repository. It runs every minute, looks for allergy information, it builds HL7 file with patient's location, allergy information, sends it over to Formfast output management, and prints the wristband automatically to the patient's area. Just making sure I'm not missing anything here. All right. Here's an example of the 2D barcoding. Trent set this up. I know he spent this to work right. And we've had it in place for whether it's working very well. But it's hard probably on this presentation. But like I said, if you get a copy of this, you can just copy this text and work with it from there. The @ symbol show how we're naming our fields. Some probably pertain to the same fields you guys are using. The second one here, where that we broke out, this repeats that 2D image at the top of the band. It's really just changing location. This is 3 different 2D images, but in our case, this actually is for another page, so we print that across the top. But for the presentation, we just cut this down. set up for the height and weight alert, the pharmacy custom parameters, the actual rule that developed for the pharmacy. And the slide shows the description behind those different lines found here. Plans for Meditech, we forward to the integrated patient portal. That's for the last item we did not have for Meditech, and us being a certified medical home, we have a great need to have that here. It sounds like it'll be sometime in 2013. We look at the LSS portal just come up because we really need for it now. On the call is aware of the different benefits of the patient portal, prepare for future meaningful use, and again, those forms have patients access to the record, access to communicate with their providers, and other benefits. Future plans for Formfast only do not have their workflow automation or the content management. We're actively looking at these solutions. The patient portal in our business office, we have some, actually, I shouldn't even say yet, we've been for the last couple of years wanting to implement different solutions to the different business office applications. We don't have the repository like we do on the clinical side for scanning and archiving, so we're really these tools to build repository like scanning and archiving, but it'd be for the business documents. We're in the future applications of Meditech that's available. Again, we're looking a little out now, and so you have immediate need that we need to address. So this is probably something we're going to be proceeding with. Workflows, an example would be manager could fill out the form, on to the second level supervisor to sign. When it's completed, automatically flows to HR and is part of the employee's record. So we have several processes like that we have a need to automate, and these solutions would definitely do that for us. Just in general, we're actively working with the state, Iowa Department of Public Health, Iowa Medicaid, to establish connectivity to the IHIN, the Iowa Information Network. We're going to be one of the first in the state to do that. Our first plan is for one of our medical home projects is to submit and exchange the CCD records for patients enrolled in those programs. And what the Iowa Medicaid will be doing, will be parsing the information contained in the CCDs to make sure we're delivering quality care as far as, making sure we're helping control certain disease, lab values, and other items like that. For future meaningful use stages, extending our health maintenance and disease management tools. We've been utilizing those quite heavily. The providers like it. It's assisting them in tracking patient care, and we just look to continue to expand on that. And we've been doing this, but we want to keep improving on clinical outcomes, utilize BI tools and other reporting tools. And as you see, that's one of the requirements for Stage 7. Hey, you're doing this stuff. What are you doing with it? Are you information to the clinicians? Are they implement processes and actually improve outcomes? Like several things. It's just one that's being looked at. And I put the cart because this year we'll have we think we're on a good plan for things, and then we might have a new medical home or something we establish with. A lot of them are very similar, but they do have different reporting requirements different requirements for enrollment to them. So, just fortunate position we're in with Technology Solutions. We're able to sit down at these meetings and implement processes to fish track and making sure we're doing everything appropriately. And I have, so if you like, we can open for question and answers.
Kyle, great information there. We're actually going to hold questions until the very end of the question and answer portion. This time we're going to turn it over to Sean Curtis for a little bit more information on Formfast and how we can provide solutions that will help you in your EMR adoption. So, Sean, I'm going to turn it over to you.
All right. And I get control screen. I'll switch over to my slides.
Should be over now.
All right. I'm Sean Curtis, Director of Product Management at Formfast, and I just want to follow up on what Kyle said and give you a little more information about what Formfast does, and kind of how we see the vision that Kyle Broadlawns has as pointing up that pyramid to a more efficient organization, a high-performance hospital. So this maturity model started at the bottom with kind of a paper-heavy organization going to a paper-light organization to a paper-free organization. And backing this up, we have the tools to get you there. And it all evolved around workflow, document, and forms management, content management, and e-signature. So these are our basic 5 areas where we provide tool sets for you to get that maturity model. So whether you're working on forms and you need form design, getting forms to an electronic format so they can be used in an output management, we can work with you there. Add into the workflow of where does that document go? It's generated. Does it go straight to your Meditech archive? Does it go to a printer? If it goes to a printer, which one does it go to? Those are the kinds of rules and workflow that we work with the output management time. Forms on demand, we talked a little bit about that as being on the nurse floor or in a clinic area and generate forms as you need them with patient demographics on the forms and documents as well. We talked a lot about that. I'm going to show you a few more options that we have around electronic signature and signature capture and the savings and capabilities about that, and as well as content management. Kyle mentioned that we've got the EMR. Everybody realizes the value of electronic medical records. What about the business office? What about HR? What about patient financial services? What about all those areas that are not clinical, but they still deal with a lot of paperwork? Being able to capture that electronically, even feed that electronically from some of our other applications, and being able to scan into it and then retrieve that information later on. So that's our basic tool set. I'll go into a little more specifics about each of those. So, as Kyle mentioned, this is a pretty dynamic system. You can kind of code different types of queries, different types of rules as to what you're going to generate when and where it goes. So our print and our output management solution, they implemented it right away, and that's how it worked out. Implementing an admission packet as soon as you're going to any form of electronic system, so that we can take the information, apply some business rules, like I'm saying down here. If the patient's under 18, we're going to print a parental consent form, or we can to print Medicaid based on information that's coming in through the admission information. So your don't have to deal with the logic behind what do I need to get for this patient because of these rules. That's all programmed into the system. Makes it a lot easier. And with consent forms, it's a limited amount of physical movement and streaming the physical flow as well as the proper workflow. And what's like in our process here is basically your users doing the registration of patients, and then they click the print button. At that point, it is turned over to Formfast, and we receive that print stream. We apply the logic that's programmed one time in the background, and read the documents. And we print those, we can fax those, we email those, we can code those. Different locations, different types of outputs. So it's not just print management; it's output management. It can never be printed. It can be sent to the next option here, the electronic signature capture, as an electronic signable document. The benefits of electronic signature are pretty odd as far as preventing delays. Signature is captured in Formfast, and it's sent to, in this case, scanning and archiving, and it's picked up every 30 minutes or so and put into the medical record. That means it's immediately available. There's no delay in your service to your patients. There's no delay waiting to see if that image is in there, if that signature has been collected. All of that is there really immediately. From having to wait for a paper chart or call down to register to look something up or to medical records to look something up. Paper at a high volume turns out to be a pretty substantial cost. So you start eliminating the items that you're required to print. It's going to end up giving you some savings, and of course reducing the physical storage of that paper. Anytime something, around the patient, you're required to store that, and for a certain time period, some cases 7 to 9 years, and in some cases indefinitely. And there's some rules as far as eliminating paper after it's been stored. So you end up, putting space just dedicated to storing physical paper, which can you can leverage that space in your organization for other things. Paper. So if you go to an electronic storage, that helps you in a lot of ways. If you do print something, then your goal is to get it into the electronic record. How do you do that? You're going to end up scanning that, indexing it. So that means another process that you have to actually do physically to find a way. And with the signature capture automation there, that's all done automatically behind the scenes. So there's more savings than actually seen just at the registration desk. It's what happens downstream from that, what happens afterwards, where change can be. I know Kyle showed us a few screens of how their system is set up, and again, we have a configurable set of tools. So we're going to show just a slight variation on another organization has set their up to e-signatures. So this screen, the registrar is being prompted to gather the signatures. The next screen is where the variation comes. At Broadband, showing a list of pages that signed their consent forms yet. And so they can then pick and choose. In this scenario, we're actually working with a record here, gather signatures for this specific record and passing that context into the screen. So this is actually skipping select the patient that they're doing broad lines, and I'm taking you into that one specific record and letting you do the signatures. You'll also see the page or a multi-form packet that's printed or actually generated for the signature process. So it shows you more than one document or multi-pages, and of course multiple signatures. We have different features built in to enable this product. We actually have a webinar that we did a month ago that's on our website under the webinars section to break out really this whole solution. If you want to learn more, that's a good place to start. We support for hardware. That's the other equation of the electronic signature solution, is picking the right hardware configuration. We support a lot of different types of hardware, including mobile, small devices that can be attached to a cart, this dual screen monitor with electronic digital signatures, along with the web signature, we call it, the written signature. Paper, based solution that really gives the patient the ability to sign a form and walk away with the paper while you retain the electronic original. So options, and it's goal for an organization to deploy multiple options across the organization. So what might work in registration may not work in the emergency department or at bedside. So we have different configurations to allow us to be more flexible for your workflow for your organization. Pointing back to the configuration at Rodlines, which is a nice configuration. The advantage here is one of the things that we can do is if the registration clerk is required to sign this as well, we have a digital signature where they can sign it with their mouse by right-clicking and applying their signature to the form, so they're not carrying the device. Some organizations will have clinics with a glass wall between patient waiting area and the working area, so these devices are on the outside of the wall or on the outside of that glass, and it still works nicely for them. Just one configuration. Again, we support a lot of different configurations, and it's about knowing what your use case is and how you want to work and your physical workflow as well. The product that supports this model is taking the forms that you've created and turn those from paper forms into electronic forms and enable them to be printed on demand or printed behind the scenes based on business logic is pulling forward another step in letting you record those documents on demand. So in this case, you would in here you would have your patient census. We have a lot of different ways to filter this so that by user we would show a certain subset of the records that are available, not the hospital census, location, and altering this geography. This is basically the documents or packages of documents that are available at this location or for this user. And also this user has a few set so they don't have to search for the documents that they actually want. So the way this works is basically, maybe the wristband or the reprint the ABM, they would just select the patient that they want to print or select the document packet that they want to print and hit print, and that's going to generate that packet of information. Also a way that you can launch into signature. So signature doesn't all have to happen at one time. Partially signed or incomplete documents can also be waiting for you to come back to them. So if I were to select the patient and select sign, unsigned documents for that patient would still be there as they show in the Rodlines example. Automation, we've talked about workflow automation in the print and the output, but so that there's the document automation, the request and approval documents, the just collecting information and pushing that into a content management system or to the medical record so it's available. Those are different workflow as well. So we offer a solution for auditing these typical forms that people are filling out and moving between one person and another. And of course, we have to distribute that to your organization through an intranet, give everybody the ability to fill this form out. We do a lot of things like understanding who the user is, so we can put their information onto the documents for them so they have less work to do. Routing based on the contents of the document. A quick example of what that looks like is, a purchase requisition. Everybody can kind of understand what has to happen in that use case. In this use case, it's basically going to go through a people for this request. The first person is going to make that request, and then the supervisor is going to approve it. And the form itself told us the business rules is this total were $10,000. It needed a higher level of approval. So to do that, we basically, the system looks at the form itself, makes a decision, and routes it based on that decision. So that gives you the ability to not automate the system, but to enforce your rules, enforce the fact that it needs a higher level of approval due to the fact that the total amount over the $10,000 mark. That's going to happen on the server. It's going to determine what you're routed to. And there's audit records, so we know who started this. And then internally to Formfast, we have reports and analytics that can show you two sides of the story. One part of the story is the audit trail and how long it took for this process to take place and who was involved, and you can aggregate that across a number of events and kind of measure where your blanks are, where your problems are. And the other side of the data and analyze is what's being collected on the document itself. So in this case, it's an approved purchase request for the department. You can see, what's the dollar amount for Dell in the last month or Manpass in the last month, and get a nice chart of that. And then the other thing they can do with our reports is put those on a schedule, so you can run that report regularly and send it to a group of users or a group of your staff or management team, so that they can keep track of different processes and understand what levels of activity are happening, documents, be it, or maybe it's coding queries or event reports or risk management type things too. So there are things that our customers apply this tool set to. There's a lot of things that we can improve in an organization that are really falling through the cracks or not being addressed or identified as problem areas. So we apply this tool to a lot of different things across the entire organization. Then I mentioned the manager, and I talked about that a little bit about, this is where you have a lot of documentation, a lot of paperwork. You've understood the value of an electronic system, and there's also a value set for an electronic system outside of the clinical. So you're looking at account payable, ability to process images, get content to a system so that it's available to multiple people rather than as paper, electronic forms, and working with content management system to kind of feed that so that you're actually eliminating some paper, as also paperwork goes into a content management system and then is available in that content management system. And to share that across your organization so that rather than making a lot of phone calls or looking for things and tracking things down, you have an interface to get to your contacts, your accounts payable, your records, and those types of things. So how we get around to all the areas of your hospital with all of our technology and help you get up to that maturity model. One slide that I almost skipped is, basically the content management works as an electronic filing cabinet. So you look at your filing cabinets that you have, and you can make that in an electronic format. But then above what you have in this scenario of a paper environment, you get cross-index searching, being able to search this entire cab for information and pull that out in a usable format, rather than having to search multiple paper folders to find information. How Forms is delivering a tool set to help organizations move up the maturity model and up the requirements models that you have to move more electronically, operate more efficiently, and become a more high-performance organization. So we're going to open it up to the questions, both for me and the Broadlawns team as well.
Perfect. Excuse me. Thanks, Sean. We do have a few questions that have come in. The first one is for Kyle. Does Broadlawns scan any documents into Meditech or all point of contact?
Yeah, we scan forms in other areas other than point of contact. We have like respiratory care. These are PFTs. PFT forms and other things like that. We also scan in medical records. EKs we currently scan in, and cardiologist makes notes on there in the sign routine. He'll go in to sign and put text on there and actually sign it. Did that answer your question, or is more. Point of contact dollars are in the areas using e-cig. The only thing we're really scanning are, IDs and insurance cards. So.
If there's a follow-up question to that, feel free to send that in. Another question for you, Kyle. What role did physician guidance play, or was the EMR mandated by tech staff and administration?
Definitely not by tech staff. I have a mix of both providers and administration. We actually have, providers on our senior leadership committee. All of our providers actively practice in their clinics or in the inpatient area. So I guess definitely a combination of both. There's certainly physician involvement in when their clinic comes up. We don't just put together a solution and throw it out there. We give them the ability to custom their own order sets, any favorites they have, medication strings, templates. So we know it's not good. We want to utilize it, so we try to make it as efficient as possible for them and comprehensive enough for them.
Perfect. Another question for you. Did you study workflows or processes in advance, or just dive in? What did that process look like?
We definitely evaluate processes before we implement. Not identify potential issues, and the area or the administrators in that area, they're making their way to do it, but still identify workflows prior to implementing any solutions.
Okay. Let us know when you're planning to apply for stage 7.
This fall, we actually have a few projects we're just completing, and then we're basically going to comb through and make sure we have everything up to par. We're working on our downtime documentation, one of the requirements for stage 7, and so we're planning like September, October. Definitely have our different works put together and any issues we may have out there.
You mentioned CCD exchanges with other facilities. What is that used for?
That for a couple of our home programs. One with our state, some mental health medical home. Patients enroll and just they receive comprehensive medical care as well as treating their certain mental health. And what we do is we actually, if they're diabetic or another disease, we submit those CC records that are then parsed for that information. And we recently acquired the CCD interface, and that's what we're actually going to tie into that state Iowa Health Information Network. But for the medical home projects, they're seen in our clinics. We actually have utilized a scripting software from Summit, a Meditech data repository, and then we basically a list of the enrolled patients that were seen that day. It creates their CD and then transfers it over the secure tunnel to this medical home, I guess as you would call it, and they then parse that information. And very similar process for the other exchange we have going on.
It looks like we have one final question. What approach to training, and how many people did you get involved as super users?
Tried to get super users in every area on every shift. We use on the solution going out. Some we trained every staff member. Some solutions it was we would train the super user would train the staff. But primarily what we do have workshops for certain time frames, and they'll come and get first it just starts out simple navigation, and it gets into actual hands-on training before they start to use it. So it's primarily that approach where they come in, they do get some hands-on, and it's required that they do that. And that's usually the model for our rollouts.
Okay, one more question that just came in from Sharon. She wants to know if you use Formfast for your document archiving or for another vendor.
Formfast we did not use for document archiving at this point. We use text scanning and archiving for clinical forms, anything that can be tied to a patient record. But in one of our plans that we were talking about with Formfast is we definitely are investing in their content management for business offices. So it would be the equivalent of the scanning and archiving, or which feeds to the electronic legal record or the EMR for the patient records. The content management from Fast would do the same for us on the business side of things. So currently they're not our repository for anything.
Another question that just came in, and we'll take another moment to collect any final questions. How much did it take registration to start using eSig?
20 maybe. I mean, it was for them to get a piece of paper off their printer than it was for them to start using it. We sat with them on a couple patients, and normal workflow, busy time of the day at first, starting out, and they pick up quick. We did calls. We actively monitored the cold feed interface, looking for any problems that need to be, while it was in production. Didn't anything, major, just a small change to how the file was named. But once it's all in one area, they all want it. It's just very intuitive and easy for them to pick up.
And we'll follow up to that. Jane would like to know if you use e-signature for release of information.
We currently do not. We're currently just doing the point of contact, but it can definitely be utilized there. We have several things that we're looking at, plans for utilizing it. Just our first is the point of contact, just because the volume. It's we do consents on practically every visit, so that cuts the volume of paper and time right off the bat, and then I'm definitely looking at those other areas where we can see efficiencies.
Great. I believe that's the last question we have. So I'd like to thank Kyle Hansen and as well Sean Curtis for their time today. Both great presentations. Just a little bit about some upcoming events that we have. Our next webinar on July 26th, 11 a.m. Central Time, is going to be entitled Better Processes, Better Outcomes. We're going to be talking about how you can analyze key performance indicators to improve the business of healthcare in your hospital. That we recommend attending: members of the Financial Services Department, executive team, risk and quality managers, members of the HIM department, and IT staff. You can register at formfast.com/webinars. We're also making a screen available at the end of this session where you can click a link and go directly to that registration page. To find out more about some of the solutions that we've talked about today, e-signature or FastFlow that Sean talked about, feel free to reach out to us on the same page that you'll see at the conclusion of this session, and that'll allow you to set up a meeting with one of our consultants. And we'll see you next month for another Formfast educational webinar.